Assalamu alaikum. As Dr. Ahmad already introduced me, most of you already know me. I'm Dr. Tayyib. I'll start with the name of our God, the most magnificent, and with his Iyaka na'budu wa Iyaka nasta'in, we'll start our presentation. Okay. So the topic in hand today is the mind-gut connection. It's been there in my mind for a time because Dr. Ahmad introduced me towards the topic. What we are talking about is a second brain. So the outside the brain and the spinal cord, the largest collection of neuron is inside the gut. It is affected by the microbes and many other factors. So this axis is now coming towards the attention of psychiatrists towards the prevention of many psychiatric illness and as well as in the treatment of some of the illnesses. So this is a bidirectional communication between the CNS and the enteric nervous system. It links the emotional and the cognitive center of the brain and the peripheral intestinal functions. So what are the components of this axis? As we have said, CNS, autonomic nervous system, enteric system, hypothalamic pituitary axis is very important, and the vagus nerve is the last one that is coming into intention because of its effect in early coming of the dementia, Alzheimer's disease. What are the means? It has neuronal, endocrine, immune and hormonal links in between each other. We all know from the brain that this is the HPA axis, stress response, the cortisol will release, it will act on the body, this is the main hormone. But there is negative feedback, there are some metabolites by the bacteria that will affect. So there are multiple things that I was not aware before the presentation. So if we talk about the gut microbes, what comes in our mind? Yani? What gut microbes are in microbes in total in our body? How many are they? What is their effect on our body? So the 50% cells in our body are microbes. 50% in our body. 99.5% of genetic material is microbial. The numbers is there. So what are the factors that will affect the microbiota in our body? Because every individual have a separate strata. It will not be the similar for everyone. So it will be affected by the age, by the geography, diet, stress and the medicine use, particularly the antibiotics. So we'll talk about the principal mechanisms of the bidirectional brain-gut microbial axis. First we'll talk about how the microbes are going to affect the brain, and then we'll talk a little about how the brain is going to affect the microbes or the intestine. I think most of our knowledge is towards the brain affecting the intestine, and the newer things are coming about how the gut is going to affect the brain. First of all, this presentation is just an introduction. It's a very vast subject. When I started reading about it, I couldn't cover. So even I couldn't read for myself, just for increase my knowledge. It was very difficult to present all of it in this presentation. This presentation is just intended to give you a brief introduction and maybe provoke your thought, maybe motivate you to read on it on the subject more. So from the gut microbes to the brain, it is the production, expression and turnover of the neurotransmitters. It is from the gut microbes, not from the brain. So it is coming from the gut. It will alter the concentration of serotonin, GABA and BDNF. And most important here is the BDNF, not the serotonin. There is a role of serotonin, but BDNF is the important one here. What it will do is, maybe in the later slide we'll come to it again, there is a protection of the intestinal barrier and the tight junctions, because once the junctions are not tight enough, there is a leak. It will let the molecules enter from the intestine to your bloodstream and go to the brain. It can be a metabolite of the microbes. It can be a part of the food that will enter inside that should not. What it will do is, it will cause inflammation and it will trigger the HPA axis. It will modify your pain perception. It will increase your anxiety. It will alter the side of hypothalamus. We'll talk about it later on. So as I've talked about that, it will modulate the enteric sensory efferents. The efferents are, what are the efferents? These are the sensory input from the gut to the brain. So it will include it will go through the spinal cord and to the brain. It will also involve the vagus nerve, right? So it will alter your gut motility and pain perception. I've already talked about some of the effect of the bacterial metabolites, and it will also modulate the immune regulation by the tight gut junction. Okay, so we'll talk about the bacterial metabolites. They are very important. So the bacterial metabolites, they will be structurally similar to some of the neurotransmitters. These are the GABA, serotonin, melatonin, histamine, and acetylcholine, and they will serve the same function as they will do, but they will be secreted by the gut microbes. So they are in structure similar to these neurotransmitters. It will stimulate the sympathetic nervous system. It will stimulate the mucosal intestinal serotonin release. It influences the memory and the learning process. Now, from brain to gut, there is alteration in the mucus secretion. It will increase the mucus formation in the gut. It will alter the biofilm production. So biofilm is the gut microbes. They will attach themselves irreversibly to the gut, forming a barrier, and plus their secretions will form a barrier. So this barrier will protect your gut. Yeah, normal flora. So this is the biofilm. So this is very important in terms that biofilm is something that is important for the maturation of your brain up to a limit of the age. For example, they have studied the animal model. What they did, they give them antibiotic or they become the germ-free animal. Like the mice, they studied them and they made them the germ-free. So at a certain age, when they did this, so it affected their brain maturation. The intestine became slow, the transit time became slow, there was abnormal intestinal enlargement in certain areas of the brain, plus the brain, the hypothalamus, the reactivity toward the stress changed, the memory response, it changed, and later on when they reintroduced the gut flora, all of these things reversed. There is alteration of the intestinal permeability controlled not only by the gut flora, it is also controlled by the brain. So what it says, a stress level for only 3 to 4 hours can change your gut flora. Only a stress level that you will be stressed for maybe few hours, 3 to 4 hours, it will alter your gut. This flora in turns, it can lead to intestinal permeability, again triggering an immune response in the body. Now to talk somewhat about the food and the brain, my colleague Shaukat, he already discussed some of the nutritional supplements and their effect on the body. But what I'm talking about is just food and the brain. So what type of food we are going to eat and what is going to do to our gut flora, and in turn it will affect our brain and the psychology of our brain. So for example, there is a study, they say that chronic intake 4 months of high fat, high sugar diet increases free radical generation, protein oxidation and neuroinflammation, in turns reducing the BDNF in hippocampus. There is cognitive deficit, there is the place recognition memory is affected the most one within a 1 week time. Healthy adults who ate a high fat diet for 1 week perform worse on task measuring attention, speed of retrieval than they had prior to the diet. There is also one study where they say that if a person who has IBS, irritable bowel syndrome, if their flora is somehow transferred to a healthy individual for any means, for example, unhealthy hygiene or something else, they will also develop IBS just by the alteration of the gut flora. Now, the term psychobiotics, it was coined by Denian et al. In 2013. As you can see, it's a recent one. They are talking about a novel class of psychotropic. They are defined as substances. These are substances when ingested in adequate amount. So the importance is the substance and in adequate amount, and I think we can add the adequate duration as well, because what we lack in our contemporary science is we say, okay, the vitamin D is important. Okay, at what dose and what duration? Vitamin B is important. What dose and what duration? To what symptoms, and how much reduction you are expecting in the score of Hamilton Depression Rating Scale. So we are lacking in this kind of knowledge. We have studies. All of these slides that I've made is backed by science, but the quality of science and the number of the participant is a question that we need more studies on that rather than just to apply all of these studies. So when they are ingested in adequate amount, they produced a health benefit in patients suffering from psychiatric illness. So what are these substances? So these include the probiotics, these include the prebiotics, these include the synbiotics and the postbiotics. Not to be confused by these big names. So if you have a living organism, right, that produce a healthy benefit when applied to the skin or to the gut, it's called a prebiotic. A probiotic. A prebiotic in terms is something that is indigestible by your spine, like a fiber, like indigestible starch. Well, you will eat it, it will produce a beneficial effect to your gut. The synbiotic is a combination of pre and probiotic. In terms, the postbiotics are the dead organisms or inactive organisms. When they are ingested, they will produce a healthy benefit to your body. So what they can be taken as supplement, functional food, and improvement in your dietary intake. We'll talk about certain disorders and studies related to introduction of the prebiotics and the result. So we'll start with the stress. They did a prebiotic intervention. Now, why they choose this particular type of organism and why they choose a particular period is not very well explained. They could have chosen another bacteria, but what they did and their result is shown. So they give it this particular.
This is probiotic, not pre. Probiotic.
Probiotic is
a living organism.
A living organism. So they give it. They gave that person for 12 weeks, and that resulted in decreased stress and anxiety, improvement in memory and cognition. They enhance the serotonergic signaling, increase plasma cortisol and pro-inflammatory cytokines. We'll go from here towards the very interesting topic that student during their exam, the stress during their exam. So they gave again they gave an organism. Yes. Yes, there is a probiotic intervention. Why they choose again for 8 weeks, and what it led to decreased salivary cholesterol level. It means that the cortisol level decrease in their body. There is a decreased physical symptoms of stress and anxiety was noted. They also, I didn't go in detail, but they also applied scales. They had the number of scales, how much decrease in the points, each and every one there. If you include everything, could not present it today. So it's just a glimpse of what's out there. Okay, a very important link. So what I've studied till now, psychosis and mania is not affected that much. The main target of the symptom is the stress, the depression and the anxiety. But interestingly, there was a link with the autism spectrum disorder. What they did is that they took a sample of the microbes from their gut of the autism spectrum disorder patients, and what they found that was a dysbiosis. The gut flora was not okay. Right? It was not of normal flora. The equilibrium was disturbed. With the introduction of the probiotics, now this is the term they are introducing, not one. They introduced a multi-biotic in this case. They give it for a period of 3 months, and there was a improvement in scores in the autism severity scale, independent of the drug they were using. So it is not because of the drugs or not of the because they had separate charts. There was only social support, and there was the group with this probiotic. So there was more improvement on this probiotic regime, the group, than the social group. The social group improvement was less than this group. So clearly there was improvement in autism spectrum disorder. There is improvement in the stress, especially during the exams, and there is also been studied the cases of IBS. They again they introduced one of the bacillum. It was given for 6 weeks. There was improvement in depression. Surprisingly, there was no effect in anxiety in the IBS patient. As prior in our slide, we have seen that the patient with the stress, they have some improvement in the anxiety as well. But the IBS patient, there was no improvement in the anxiety, and there was improvement in quality of life. But to this point in IBS, we should know that the probiotic is introduced. Not every disorder is benefited by each group. So if you are to give a prebiotic like a fiber to a patient of IBS, it can produce contrary result. For example, their illness can worse because it is a mass producing, it will stimulate the gut, so they may have more diarrhea at times. So the fiber is not very healthy for the IBS patients, not always. Okay, the last one is the patient of depression. They have different studies. One group involving the study of multibiotics. The second one was with one bacillum plus SSRI. It was given for a period of 8 weeks. Again, these studies are randomized with a social group, a social support group as well. And but they found there was more improvement in the patients who received probiotic. There was improvement in depression. There was improvement in attention and the verbal learning. Okay, now coming towards last of our slides and to conclude our presentation. This particular study was published in Lancet in 2015. What it says is that nutritional medicine should now be considered as a mainstream element of psychiatric practice, with research, education, policy, and health promotion supporting this new framework. Okay, waiting for your questions, and thank you for your time.
Any question, any comment?
Presentation.
Thank you.
Information for me, most of it are just doing it for the first time. So we will postpone our question for after we leave.
Yes. Okay. The references will be provided if there is needed, because there was list of 20 studies. So I thought if there was a need, I could provide the references for this.
نحن اليوم حياكم الله دكتورة، مرحبا بكم، يا هلا ومرحبا، الله يسلمك. اليوم الدكتورة شوق تكلمت، سنسات طب هي ما شاء الله، تكلمت عن السبلمنت، نيوتريشنال سبلمنت وعلاقتها في السايكاتري وايش الدراسات. ادتنا مقدمة. الدكتور طيب تكلم، هذه محاضرة تعريفية introductory lecture about mind gut connection. الكلام عميق، وكل ما نتعمق أنا في الحقيقة one of my patient قبل سنة وشوية تقريبا هو اللي خلاني يزود عندي الانترست. أبوه كان يعني منصب كبير في الدولة، وجاء من للمدينة زيارة، وهو ولد سكيزوفرينيك، والأبو هذا صاحب المعالي كان مقتنع إنه السكيزوفرينيا سببها يعني ريليتد بالانتستينال فلورا، ومطلع وعنده كتب ومصادر. من فين جبت هذا؟ نحن ما درسنا في السايكاتري تبعنا، وكلام وبحوث ودراسات. فزاد الانترست في علاقة الأكل والشرب والجي اي تي والفلورا مع تأثيرها. جات المصطلح حق second brain وكلام كثير. as you said it is يعني